There's been an assertion in the public and certainly among politicians that undocumented migrants are taking up services such as health care that they're not entitled to. But everyone is a human being. Everyone somehow at some point gets sick and will require some kind of health care.
When people don't have access to health care as individuals, they are sicker. They are part of a larger community, though, and that means the entire community is sicker.
In the United States, insurance is your access card to care. The challenge is that we think over half of the undocumented in the United States are uninsured, and those costs are then shared by the rest of the community.
The impact that it has on your economy, the impact it has on you personally in terms of, am I able to eat? Am I able to get needs that I have taken care of? That doesn't happen if you don't have a well society.
A significant segment of the undocumented population doesn't have any meaningful access to preventative care or even to the kind of care that is available when they're first sick. What they have instead is access to emergent care.
Under a law that was passed in the 1980s under the Reagan administration called EMTALA, the Emergency Medical Treatment and Active Labor Act, emergency rooms have to treat whoever comes into the emergency room.
So in that sense, anybody can walk into any emergency room and at least get enough of a screening exam to determine whether or not they have an emergency. Then they are able to get treatment at that emergency room right then and there, regardless of their ability to pay or whether they have insurance, whether they're a documented or undocumented person.
The way that hospitals and other healthcare organizations deal with the emergency room utilization for uninsured people, including the undocumented, is they get funds in other ways. They get funds from the federal government or the state government for uncompensated care. They charge higher prices to those of us who do have employer-sponsored insurance, and so the rates that we pay compared to government programs is about 2 to 3 times higher. So we indirectly pay for the care for undocumented folks through the property taxes that we pay, through other tax forms, and sort of this indirect tax that employers pay for employer-sponsored insurance. But the undocumented are also paying their fair share of the taxes.
They are paying property taxes by virtue of either owning a place or renting a place, and property taxes are what pay for healthcare services that are provided in large counties. They also often pay into Social Security and into the federal income tax system, even though they don't ever get any of that back.
Every year, the federal government reports around $10 billion in taxes from these immigrants. We don't know who they belong to and who we should disburse them to, but people are real and they're using services. We just don't have a match because we don't know who they are, where they are, and that's why people say they're not paying for it, but the money is actually there. You know, when we talk about healthcare expenses in the undocumented population in the country, one of the questions would be whether they can buy their own insurance so that they don't end up in the emergency room. Yes, they can buy their own insurance, but you know, buying insurance in this country is very expensive. And if you have a wife, a husband, or 2 kids, 3 kids, 4 kids, however many you have, they're probably not going to be able to afford the general rate in the regular insurance market. And so the next question, of course, is whether they can participate in the discounted rate under the Affordable Care Act. And the answer is no, they cannot. Of course, the result of this is they fail to buy insurance in the private market and they end up in the emergency room and it costs everybody more.
Part of being in the shadows of the U.S. economy also means they delay care and don't go to the emergency room when they probably should. The problem with that is that you have people in the emergency room that have later disease state. They are sicker than they would be. If they would have come in sooner, they might have been able to be treated at a lower cost. And so what you have is higher cost of treatment and more severe conditions.
You hear these stories from ER doctors where one of these patients will come in and the doctor will do whatever the assessment is, and medically or legally, they're not truly emergent yet. So they'll say, you're going to need to wait 2 more days. Then you'll be sick enough to come to the hospital. We'll admit you, and then you'll get the treatment that you need. That is just a crazy waste of resources, human and financial. Even if you don't personally care about the undocumented, they're part of your community. They are working in your grocery stores. They are working in your restaurants, handling your food.
And some of them, over 400,000, are working in the healthcare system itself.
You have quite a number of people in healthcare that work as home healthcare aides or personal care aides. These are people that work in nursing homes, for example. You have the custodial staff, the staff that works in the hospital kitchens.
So in some ways, they're also contributing to our own health because they're workers and they're tending to us. They're obviously working with our healthcare and they're providing a service to us. So it's important to also understand and appreciate what they contribute to the economy and then facilitate their ability to participate in the healthcare system.
This is a critical portion of our society, a critical part of our economy. All of these pieces are critical to our individual well-being, our ability to go throughout our day and for each of us to meet our needs.
Either way you look at it, the benefit of making sure that we're all healthy and well, to me, just makes sense.
There are a couple of places where we have avoidably created barriers to health and to wellness for undocumented populations. And the challenge there is that doesn't keep them from getting sick. What it keeps them from doing is being able to be fiscally responsible for their own access to care.
We pay for the cost of the uninsured, and we do it in a very fragmented, very confused way. The way we do it now is more expensive than it should be, and we have more disparities in outcomes, and it could be done much more efficiently if we knew who everybody was and could actually manage the cost.
I think it's really important to figure out how to allow them to take care of their own, because that, at the end of the day, will save us a considerable amount of money. I think that a very key change to the system would be to allow employers to offer them an insurance plan just like they do to most of their workers. And you allow the individuals that don't have an employer who offers a plan to acquire it in the regular market, then you cover most of them. And then you only have a small group to take care of at the end of the day. Now, a third option, of course, is regularize their status, whatever that may be.
If there was an ID program and people knew that it was safe to enroll in the programs that were available for their children, for spouses, for whoever, then we'd also get more people into coverage earlier. And getting people into coverage earlier actually saves money. And so I'm a big believer in improving outcomes in ways that are more cost effective.
I think we should take a look at this as a public health issue. Ensuring that we have a healthy, productive workforce is good for everyone. All those of us who are receiving these services and goods that are produced by all workers, and that includes the undocumented.
This notion about who is deserving permeates so much of the access to benefits, access to healthcare in our society. But at the end of the day, we have to be invested in the health of each other because our futures are all intertwined.